So yesterday I had my cardiac surgery and procedures, and I thought I would share what happened in case there's anybody out there that is also going through something similar or might be facing that in the next, coming future. So I hope this is helpful, and anyway, I'll just dive right into it. So I'm pretty much ready to go, just waiting at this point on my husband. He has a couple more things to do, but I've been fasting since midnight. I already took a couple pills just with a sip of water. The doctor said that was good. And that's about it. We're going to be leaving. I have to be there at 7 for, I guess they're going to start at 8:30. So I didn't get much sleep last night, to be honest with you. I was pretty much up all night. I finally went to bed at 3. I had pulled something in my shoulder. And thankfully, before midnight, before I started fasting, I did get a couple Tylenol down. So that did help, but I didn't really feel sleepy until about 5 o'clock when it was time to get up. So anyway, I'm ready to go. I will try to update you to as much of this as I possibly can, and I will see you in a little while. So I'm all ready to go. The only thing I'm going to do right now is a little bit of arm exercises. I'm just using a band, and I'm going up and down with my hand, just like I'm doing using a dumbbell. The reason I'm doing this is because I have terrible veins. And, when you exercise your muscles and your arms, you have a little added bonus because it makes your veins and everything kind of come to the surface. So I'm going to do a couple of these. I usually get an IV in either the right arm or the right hand. And I don't want to get poked 10 times. I have before. So I'm just going to do a few of these, take a little rest. All right, I just got here. I'm in the waiting room. I'm a little bit early, as usual. So I'm just waiting till 7 o'clock, and then I will be checking in. So real quick recap. Last Thanksgiving in November, I actually had a recurrence of some really severe AFib. Also, I guess I had developed something called an atrial flutter. And I have some other issues going on with my heart, but those are not things that I really had to address. But the AFib, the type that I have, has a very rapid ventricular response. It can cause a lot of problems if it's not controlled immediately when it really gets out of control. So anyway, to make a long story short, I had ablation done back in 2017. It was very successful. I really haven't had any problems with the AFib since then. And over the last, I'd say probably the last year and a half, almost 2 years, I've been seeing a cardiologist. They test me like every 3 months. I have to wear this stick-on thing that they can monitor me for like 14 days, and I do all the different tests, and I developed it's called supraventricular tachycardia. It's like a fast heart rate that you get, but I only get it for like maybe 15 to 20 seconds. Well, I started having a lot of anxiety, and I think that anxiety was coming from these weird things that were going on in my heart. So anyway, my doctor put me on Eliquis last August, even before I had the AFib reappear. And AFib is actually a kind of an acronym for atrial fibrillation. Mine is with a rapid ventricular response. So that means my heart rate can go super high and can be a little bit more dangerous. But so what happened is that he put me on the Eliquis kind of as a preventative measure. And honestly, I think it probably saved my life, because when I had that happen when I was at Thanksgiving in Minnesota, by the time I got to the ER, I mean, I was a train wreck, and it was never like that before when I had this previously. Well, I come to find out I had also developed an atrial flutter. So I think between the two, you know, my heart was really playing ping pong. So anyway, we scheduled this surgery to go in and fix the atrial flutter. It's gone. It was taken care of yesterday. I had cardiac ablation, where basically the doctor goes through your femoral artery. He goes up, you know, all the way to your heart, and it either gives a super cold where it freezes parts of your vessels of your heart, or it heats them. So I actually had the cold one, the cryo surgery, last time in 2017. This time I had the burning one. They did that. They fixed the atrial flutter. Because I probably am going to have this problem the rest of my life. My doctor said I just will always have to deal with the blood thinner issue. Well, I've taken a couple big falls also. And so he wanted me off the blood thinners. So since we were doing the cardiac ablation, he also inserted something called a Watchman. It's an implant that goes into your atrial appendage. I guess it's an appendage off your atrial part of your heart. And it basically has like this little strainer. It opens it up after they put it in, insert it, and it just makes it so that any kind of blood clots get caught through this strainer. So it greatly reduces your chance of stroke, and it gets you off blood thinners. So within the next 3 to 6 months, I should be completely off the blood thinners, just taking a baby aspirin the rest of my life. I'm so excited about that. I don't like being on blood thinners for a lot of reasons, mainly because, you know, you fall, hit your head like I did in September, you know, it could be catastrophic. So anyway, I had that done, and they also, what else did they do? They did something else. I can't remember. They did 4 things. Anyway, they got all of that done. Oh, they did a transesophageal echocardiogram, where they actually put a tube down your throat, goes in your lungs, back behind your heart, just to make sure there's no clots, I guess, after you have the surgery done. So I had a lot done yesterday, and happily, I'm here to report that the last thing I had done was I had something called a loop recorder, and they had inserted that about 6 years ago. The doctor could monitor what my heart was doing. I had that removed. So I did get cut in my chest. I also have where they went up through my femoral artery. I've got a stitch there that's, you know, just basically had a bandage. I took that off this morning and put a little tiny bandage on. And I don't really feel the, you know, anything from the cut on my chest at all. It's just painless. I'm having more trouble with the one on my leg, just mainly because it's where your underwear kind of rub against it. It's just in a very bad spot. But it's teeny, it's just a little itty bitty thing. So I think it's going to heal up pretty quickly. I just wanted to talk to you a little bit about, you know, what the procedure was like, what the surgery was like, what the process was like. Well, first of all, I had just a wonderful experience compared to last time. Oh my gosh, last time was very traumatic. I had to do the echocardiogram thing where they put the tube down your throat the day before the surgery. This time they did it while I was under. I did get a general anesthetic. So I fasted the night before. I went into the hospital. My appointment, I needed to be there at 7 o'clock in the morning. So my husband and I got there, we checked in, I got back to a room. They did 2 IVs. They did 1 in each arm. And then from there, the doctor came in and talked to me. The anesthesiologist came in and talked to me and just went over all my basic information, told me what they were going to be doing, what to expect, all that kind of thing. I went in, everybody was wonderful. There was such good staff. I was at the Heart Institute here at my local hospital. Everybody, I mean, from beginning to end was absolutely phenomenal. And my doctor, I just love him to death. He's just so wonderful. So, and really like on top of studies and explains everything really good. I mean, just you can tell he really is, you know, good at what he does. So I really have, the last ablation, I was having like kind of flutters and all that after the ablation. I really had none of that this time. Other than the little soreness in my leg, which was worse yesterday, it's better today. I really feel pretty good. Now, they did say, you know, you can't tie your shoes for a couple weeks. I can't lift anything more than 10 pounds. So I did ask him about going to work out. He said, yes, that's fine, as long as I didn't lift more than 10 pounds and just, you know, be careful of my incisions, which I will be. I'm going to take this week off and then I'll go back on Monday to start doing my training again. And my trainer's aware of this, so he's going to work with me to make sure that, you know, we aren't affecting any of these areas that have been worked on. But I think the most excited, I'm going to get off of the blood thinners. I'm going to be able to get off this antiarrhythmic medication that I've been taking, which I've just hated since I've been on it. Now, it has stopped me from getting any more episodes of the ablation, but the problem is I don't know, I just feel off with it. I feel, first of all, it tastes terrible. If you've ever taken prednisone before, that's what it's like. It just leaves this horrible aftertaste in your mouth. So I have to kind of take it with something instead of just water. Otherwise, it kind of gags me. I've made it a goal for myself personally. I don't know if this is possible, but I take some other pills too. I'm going to try to get off everything that I'm taking by Christmas 2026. By New Year's next year, I want to be off all medications except for the baby aspirin. So my doctor did say that the ablation does fix the atrial flutter immediately. That will not have to do again. The atrial fibrillation isn't something you really ever cure. It's like a fix. So we may have to do the ablation again at some point in the future. This last time, it lasted me almost 9 years. I mean, that was pretty phenomenal. And I really have, you know, I have to still see the cardiologist and have my appointments and all that stuff, but it's been a pretty good almost 10 years since all that chaos happened before. So I'm hopeful I can buy myself another 10 years before I have to go through this again. But they made a lot of improvements. If you're looking or facing something like this right now and you're trying to manage it and live with it and having episodes and all kinds of other things, you know what? Maybe talk to your doctor about some cardiac ablation. Now, my doctor told me that it was, you know, we needed to do it because of the type of AFib that I have. But you know what? If this is something you're interested in, maybe research it, talk to your doctor. And I think it really does help. It helps to kind of give your life back. And for me, I felt like for the last almost 2 years, I've been getting my life back slowly but surely. Since I had my knee surgery, I feel like I can walk. I don't know if I can run yet real good, but I just do so much more in the way of exercise. I push myself. I lift weights now. I'm still on this path to losing weight. So I have some really exciting things I'm going to share with you on Sunday about some ideas that I have for finishing up my last bit of weight loss. And as you can see from some of these pictures, they're not my best moment as far as how I look. I know it's kind of hard when you go to the hospital. You have no privacy there, flinging everything off as quick as you can cover yourself, but it's okay. I'm glad it's over. And then the last thing I was going to share with you, I thought right up until the day before the surgery that I was going to have to cancel it. My grandson had his 5th birthday a couple weeks ago. And there was a little girl, their little friend, who came to the party with pink eye. Well, I was the only one at the party that got pink eye. That's why you haven't seen too many videos. It was terrible. I mean, it took like since last Thursday to get rid of it. So after the pink eye went away, I was, continuing the antibiotic eye drops. I developed a sty in my right eye. So I read online that sometimes you go into the hospital and they'll cancel your surgery, once they review everything and see you have a sty. So I took pictures of it literally the night before the surgery, sent it to my doctor, explained what had happened, told him I was still on the antibiotic eye drops. He said, stay on the eye drops until the surgery, but we were still on. I was fine with the sty. Those are not contagious. The pink eye was, but I don't have active pink eye. So I would have hated to have to have gone through all my blood tests and all that stuff again. So anyway, it's all over. It's all done. My heart is now healing from the ablation. The ablation, they actually go in and kind of cauterize around the 4 blood vessels in your heart. And it takes about a month or 2 for that area to really scar up really good. So I will have, sorry, I don't know, I've kind of been coughing, and you know how it is when you have like a tube down your throat, everything's sort of sensitive in here. But after everything scars up, it's golden for a long while in my situation. So I will have to stay on this flecainide until the antiarrhythmic medication, until I'm completely healed from this. But you know what? It was something I would actually recommend. If your doctor recommends it, do your own research, of course, listen to your doctor, make sure you have a good cardiologist that does a lot of this. And, I wish all of you the best. I'm going to pick up the pace as far as the strength training over the next month. Not now. I want to make sure that, I'm not lifting too much weight, and I follow everything he says. I go see him again in 2 weeks and then again in 4 weeks. But I am planning on having, everything pretty much done by the end of 2026 as far as my weight, my body being more toned, being more active, feeling more fit and better and healthier. And I just feel like with the things I've had done over the last 2 years between the knee and my heart, I just feel like I'm on this really good path to health. So anyway, that's what's been going on with me. I should start posting videos again, this week, and probably going to take it easy the next couple of days. My husband's going to be here kind of just helping. I do have the grandkids coming, but I'm not lifting anybody. I'm going to be really careful. In fact, he'll be with me the whole time, making sure to hold the 1-year-old and all that. So that's my life. That's my life today. Today after cardiac ablation, you can see, doing really good. So thanks for following me. Thank you for all your prayers. There's been so many wonderful people that have reached out to me through email, through my comment section, through all kinds of things. I really appreciate it. I appreciate every single solitary one of you for thinking about me, taking time out of your day to think about me and wish me well. So just want to let you know I'm back, and we'll be back doing our fun weight loss videos before you know it. So take care and have a great day. If you're not a subscriber, please consider subscribing. I do have a couple of AFib videos that might be helpful to you. If you're interested, check them out, and I will see you next time. Take care, everybody. Bye-bye.